Symptoms include throbbing pain, nausea, and extreme sensitivity to light and sound, and migraines can last from 4 hours to 3 days. The first step in living well with migraines, experts say, is to arm yourself with the latest information. Dr. Mula, what is a migraine?
A migraine is a subtype of a headache which is normally associated with or without an aura, and the patient can foretell when the migraine is going to present if it is with an aura. However, it is also a very acute onset headache which terminates sometimes with a vomiting episode.
Okay, so what causes a migraine?
Until recently, we believed that the migraine was some kind of vascular abnormality or anomaly, and now we know that there is a considerable amount of a genetic component. So if there was a parent who suffered from it, it is more likely that the daughter or son would have migraine. There's also migraines that are precipitated by certain types of food, maybe high tyramine foods, that's old cheese, yogurts, possibly related to some kind of substances like monosodium glutamate. That's why you have the MSG headache, which is a subtype. However, in a migraine, there could be some neurological deficits, such as visual loss.
What are the most common migraine triggers?
The most common migraine triggers are very individualized to people. They could be from just strobe lights. They could be substances such as milk, sometimes fish products. They can be monosodium glutamate.
How would you suggest a person cope with migraines?
Migraines can be recurrent on a weekly basis. Migraines can be seen after an absence for several months. Migraines could be seen in clusters, which affects mainly males, but can also be seen in females. Migraines can appear with menstrual cycles, which can be quite devastating for many of the ladies who are having menstrual cycles, which causes them to be dysphoric and, having some kind of chemical imbalances that cause them to have those migraines. So yeah, it depends specifically on the type of migraine, its frequency, and also related to how patients are able to obtain relief from appropriate medications.
What would be, in your opinion, the best non-pharmaceutical approach to coping with migraines?
Well, some people would have sleep deprivation that would trigger migraines. So appropriately, you'll need to have, you could have a proper sleep-wake time, not having too many products like caffeine at certain times. So if your sleep cycle is pretty consistent, you may prevent that kind of migraines.
Going for more than a few hours without eating causes your blood sugar to drop. This causes brain changes that trigger migraines. Never skip a meal and keep wholesome snacks on hand to nibble between meals.